students, welcome again to another yet interesting section of oral histology about dental pulp. Dental pulp is a specialized vascularized soft connective tissue like your periodontal ligament, and you have it inside the tooth, both in the crown portion as well as the root portion. Now in the crown portion it is called coronal pulp, and you use the word pulp chamber to describe it, whereas in the root part you will use the word root canal. And at the end of this pulp, you have the opening in the root, which is called apical foramen. Now, the apical foramen is the area where the blood vessels and the nerve fibers from the pulp exit and have connection with the surrounding periodontal ligament and alveolar bone. Sometimes, instead of this apical portion of the tooth, on the lateral aspect or in other areas, we may have an accessory canal opening, which is very important whenever you are talking about a root canal treatment. Development wise, embryologically, where is pulp formed from? Pulp is formed from a structure called dental papilla. So we all know that during the late Bell stage, which is also called advanced Bell stage, that's when the hard tissue formation is starting. So in the crown portion, what will happen is the dental papilla, which is ectomesenchymal cells. So you have ectomesenchymal cells there in the dental papilla that will get differentiated into odontoblast with the help of inner enamel epithelium. So the inner enamel epithelial cells will influence the underlying dental papilla to differentiate to odontoblast. So odontoblast will form a first layer of dentin. Once a layer of dentin is formed, this will influence the overlying inner enamel epithelial cells to differentiate to amyloblast. So amyloblast will form a layer of enamel over the dentin. Now, once a layer of dentin and enamel is formed, the remaining portion of dental papilla is now called pulp. So basically, pulp is developed from the dental papilla itself. That will happen only after formation of the hard tissue, that is the dentin first, followed by enamel. Only then the pulp formation will happen. Histologically, when you look under the microscope, you have various areas or zones of the pulp which are 4 in number. So this what you see is the HNE stained section, decalcified section of tooth. What you see here, this area is dentin. So you can see the outline of the dentinal tubules also there. So this is a cross section of dentin that you see. So once the dentin is over, the next layer is the pulp. So the pulp, this entire area is pulp. So if you carefully noticed, 4 zones are noted in the pulp. The first area which is close to the dentin is called odontoblastic layer. So the first layer is odontoblastic because you see a layer of odontoblast there. The second layer is called cell-free zone. After odontoblastic layer, there is one area which is devoid of cells, but you see a lot of fibers and ground substance in that area. That is called cell-free zone. And the third zone, what you see here is cell-rich zone. So exactly opposite to cell-free zone. The next zone is a cell-rich zone using numerous types of cells there. I will tell you shortly what are the cells that you see. Then the next one, the remaining portion is called pulp core. So the major part where all the blood vessels and all the other elements of the connective tissue is seen is called as pulp core. So these are the 4 histological zones that you see under the microscope. Now coming to each layer, first the odontoblastic layer. So odontoblastic layer is a layer. So we know that odontoblast is a cell which helps in the formation of dentin. Now after, the important feature of odontoblast is that once a layer of dentin is formed, so now let us assume this is odontoblast. A layer of dentin is formed, the odontoblast will retract backwards towards the pulp. Okay, so now when it is retracted, it will go back and the second layer of dentin will form. Then again it will retract backward and then a third layer of dentin will form. So I already mentioned in so many of the classes, very important point, all the hard tissues are laid in increments, layers one after the other. So after every increment of dentin is formed, there is backward movement or retraction of the odontoblast. So once completely the dentin formation is over, the entire thickness of dentin is formed, it is over. Finally, the odontoblast will assume one position, that is bordering the outer surface of the pulp. So this is the last layer of dentin form. So the odontoblast will be here. So from here, you call it the pulp. So once the dentin formation is over, the position of the odontoblast is the starting point of the pulp. So always bordering the outer part of the pulp, you have a layer of odontoblast. And sometimes these odontoblast processes will be extending into the dentin. Not always, but sometimes. And inside the odontoblast, you have lot of fluid present. Okay. So this odontoblastic process will extend into this dentin and it may be present within the dentin. And that odontoblastic process you see within the dentinal tubules is an important component of dentinal tubule. So dentinal tubule, if you take, what are the content of the dentinal tubule is? It is mainly containing odontoblastic process, because from if you take if I draw the dentinal tubule structure, then you will understand. Suppose this is one dentinal tubule and this is dentin, this is pulp. So you have odontoblast here. The process of the odontoblast will extend into the dentinal tubule like this. And surrounding that odontoblastic process, periodontoblastic space will be there. There you have the dentinal fluid present. So only the body of the odontoblast is seen in the pulp. As you can see here, this is the body of the odontoblast, whereas the odontoblastic process will extend into the dentinal tubule. The next layer is called as the cell-free zone. See here, the cell number is very minimal or absent. So this cell-free zone is also called as zone of Wheel. Wheel was a person who first described it. So it is also called Wheel's zone or zone of Wheel, where you do not have any cells. See, next to the odontoblast, only fibers are seen. In this area, only fibers and ground substance will be seen. Cells will not be present. That is why it is called cell-free zone. But what is that? There is one importance for this zone. What is that? Is that some of the nerve fibers from the pulp core may extend and go into the cell-free zone. So usually the nerve fibers and nerve bundles are present in the pulp core area. So you can see that neural plexus is seen here from the pulp core area. From here, these nerve fibers may extend and it may go to the cell-free zone and it will form a multiplexus or a group. And that plexus is called Raschko's plexus. Raschko's plexus. So this is very important MCQ question for you. What is Raschko's plexus? Where do you see it? Raschko's plexus is collection of nerve fibers that you see in the cell-free zone or zone of Wheel of the pulp, and it is nothing but collection of nerve fibers that is extending from the pulp core towards the cell-free zone. So sometimes in the textbook, if you see the location of Raschko's plexus, it is written as subodontoblastic layer. That is also correct. Sometimes in the options, MCQ options, instead of cell-free zone, you will not have an option of cell-free zone. But instead of cell-free zone, you will only have an option of subodontoblastic layer. That is the tricky question, because subodontoblastic layer is nothing but a layer beneath the odontoblast. What is the layer beneath the odontoblast? It is a cell-free zone. So you have to carefully look into the option and accordingly choose. Either if a cell-free zone or zone of Wheel is given, it is a straightforward answer that you can choose. But even if that is not given in the option, look for this word subodontoblastic layer. If that is given in one of the options, that is the right answer, because plexus of Raschko is seen in the cell-free zone, which is nothing but the layer just beneath the odontoblastic layer. The next is the cell-rich zone. Cell-rich zone is the area where you see a lot of cells. So what are those cells that you mainly see? You see fibroblasts, because pulp is a connective tissue. Any connective tissue, the main cell will be fibroblast. In addition to fibroblast, you have defense cells. Defense cells are cells, protective cells. Whenever any antigenic exposure is there to the pulp, it protects against them and tries to eliminate the antigen. You have neutrophils, eosinophils, mast cells, lymphocytes, plasma cells. Any of these cells will be seen within the cell-rich zone, and also in the pulp core you can see maximum defense cell. Third type of cell is undifferentiated mesenchymal cell. The same three type of cells are also seen in the periodontal ligament. See, very important. Lot of similarities between pulp and periodontal ligament. You see fibroblasts, you see defense cells, you see undifferentiated mesenchymal cells. In all these three, All these three cells can be seen both in the pulp as well as in the periodontal ligament. So what is the function of this undifferentiated mesenchymal cell? Whenever there is a need, this cell will differentiate to fibroblasts and form fibers. Or if there is a need, it may differentiate into odontoblast and then it can form dentin. That type of dentin is called tertiary dentin. So when a caries process is trying to cross the dentin and come into the pulp, so the protective mechanism is that the odontoblast will form a new dentin in that area and it will stop the progression of caries. That dentin is called tertiary dentin, which is actually formed from the undifferentiated mesenchymal cells. So the last layer is the pulp core, the main area. See, this one is the pulp core. So pulp core is the area where you see all the fibers, ground substance of collagen and collagen fibers, ground substance, other type of cells, blood vessels, nerve fibers, lymphatics, all the connective tissue elements mainly are seen in the pulp core. So that's what I told. Pulp core can be divided into three categories: cells that are seen there, intercellular substance, and the connective tissue elements. The cells, I have already mentioned three types of cells: fibroblasts, undifferentiated mesenchymal cells, and defense cells. Fibroblast helps in formation of fibers. Then the second one is undifferentiated mesenchymal cells may differentiate into either odontoblast or fibroblast according to the need when it is arising, and defense cells are immune or protective cells. Intercellular substance between the cells, what you see, they are the fibers and the ground substance. Fibers are mainly type 1 and type 3 collagen. A small amount of elastic fibers are also seen. Ground substance will be naturally proteoglycans and glycoproteins. Now, little bit about this collagen fibers. When you take the teeth, many structures of the teeth, except enamel. Enamel is the only tissue of the teeth which is not having collagen. There is no collagen in enamel. If you take the organic content of enamel, you have only enamel proteins, amylogenins, amyloblastin, tuftilin, only enamel proteins. There is no collagen there. Other than enamel, all the other structures, dentin, cementum, alveolar bone, periodontal ligament, pulp, all the other structures are having collagen. Mainly the organic content is mainly made up of collagen. In that dentin, organic content mainly type 1 and type 3 collagen. Same thing, type 1 and type 3. Pulp and periodontal ligament also type 1 and type 3 collagen. Cementum also type 1 and type 3. Bone is also type 1 and type 3. So anything related to the tooth, collagen is the main component in the organic portion and all of that is predominantly type 1 and type 3. Only enamel does not have collagen. This is again a frequently repeated question for you. Which of the hard tissues or which of the tissues associated with the tooth does not have collagen? The answer is enamel. So where do you see type 2 collagen? I said type 1 and 3 only is predominantly seen in all this tissue. Where is type 2 seen? Type 2 is mainly seen in cartilage. So this is important. Type 2 is seen in cartilage. Type 4 is seen in basement membrane. So all this is very, very important from exam point of view. Type 1 and type 3 will be seen in teeth and bone except enamel. Type 2 is seen in cartilage. Type 4 is seen in basement membrane. Okay. Type 5 is seen in walls of blood vessels. So this is very important. We should know that the blood vessels, the layers, outer layer of the blood vessels, they are made up of type 5 collagen. Therefore, if there is any collagen defect in the synthesis or formation of collagen, that will also affect the blood vessels. It is a very, very important point that you have to keep in mind. So whenever there is a problem with collagen formation or any defect in the collagen, blood vessel is one of the structure that may be affected because the walls of the blood vessels contain collagen, mainly type 5 collagen. And of course, the remaining type of connective tissue elements like blood vessels, nerves and lymphatic vessels are also seen in the pulp core. So the blood supply. So we have a rich arterial and venous supply into the pulp. So pulp is a highly vascularized tissue. Now this is very, very important. Why it is important clinically is that. Now let us assume caries process. Caries is caused by bacteria. First the caries process will involve the enamel. From enamel it will come to the dentin. From dentin it will progress to the pulp. Now, as long as this caries process or any other disease process is only in enamel and dentin, usually the patient is not having any pain or discomfort. Generally, you may have a cavity formation, you may have food lodgement, all that will be there, but pain is not generally seen. Only when the caries process is reaching the pulp, it is crossing the dentin, and once it is reaching the pulp, the patient complains of pain. That is because pulp is vascularized tissue. It has blood vessels, whereas enamel and dentin are avascular. You don't have blood vessels in enamel, you don't have blood vessels in dentin. Only pulp has blood vessels. And please remember a basic concept, only vascularized tissue can undergo inflammation. Inflammation is a process, it is a reaction of a vascularized tissue to any form of injury. So only tissue which is having blood supply and vascularized can undergo inflammation. So in the tooth, enamel and dentin, there is no inflammation. Only when pulp is having some bacterial invasion, pulp will undergo inflammation. That is what you call pulpitis. Whenever you get pulpitis or inflammation of the pulp, lot of inflammatory mediators are released and you get pain, because pain is one of the signs of inflammation. So you get pain, that is when patient will come to you complaining of pain. So please remember that basic concept that enamel and dentin are avascular, they do not have any blood supply, so they cannot undergo any inflammatory reaction. Whereas in contrast, pulp is a vascularized connective tissue, it can undergo inflammation and that will result in pulpitis. So there is a lot of nerve fibers also which is entering and exiting the pulp through the apical foramen. So apical foramen is the apical portion of the tooth, has small openings. Through that openings, blood vessels and nerve fibers may enter the pulp and also exit the pulp. So these nerve fibers are mainly seen in the pulp core. But some of the nerve fibers from the pulp core may go and form a plexus of nerves in the cell-free zone, which I already mentioned. That is called plexus of Raschkow. The other name for plexus of Raschkow is called parietal layer of nerves. Sometimes in the question option, this can be asked, where is parietal plexus of nerves seen? Do not get confused. That is nothing but the other name for plexus of Raschkow is parietal layer of nerves. Both are same. That is seen in the cell-free zone or zone of Weil. So what is the basic function of the pulp? They have so many functions. The first function is as dental papilla. Before it forms pulp, embryologically you call them as dental papilla, right? As dental papilla, pulp has inductive function, which means it induces the inner enamel epithelium to form ameloblast and lay enamel. So it has an inductive function. And it also has formative function, because whenever there is a need, the undifferentiated mesenchymal cells can differentiate into odontoblasts and that can form tertiary dentin. So it also has a formative function. Because of blood vessels, it has nutritive function, and because of all the immune cells and defense cells, it has defensive and protective function also. As a person becomes older and older, what changes are seen in the pulp? One is whatever cells are you seeing, fibroblasts, defense cells, undifferentiated mesenchymal cells, all the cells will decrease in number. That is true for any tissue in the body, not only pulp, even in periodontal ligament. Any tissue, the cellular number, the proliferating rate of the cell is coming down. So the number of cells also will come down. So the cells will become less in number. Then the blood vessels also will become less. So the blood supply will become very, very less. In contrast, what will happen is the fibers will increase. So we had collagen fibers, right? Mainly in the pulp. The number of fibers will increase. So dense collagen fibers will form. That condition is called fibrosis. And in addition to that, very important thing that you see is formation of calcifications within the pulp. These calcifications can be of two types. Either they are called number one denticles or number two diffuse calcification. What is the difference between denticles and diffuse calcification? Denticles are of two types, true denticles, false denticles. So what is the meaning of that? If the calcification is resembling a dentinal tubule structure like that of dentin, then you call that as a true denticle, resembling a dentinal tubule. Whereas if it is not having any resemblance to the dentin or dentinal tubule structure, then you call that as false denticles. The other name for denticles is pulp stones. So you have to know the other names. It is very, very important. because in the questions and in the option, sometimes the synonyms or the alternate names will be used. If you are not aware of that, even though you know the answer, you will not be able to give the right answer. So always keep in your mind the alternative names and synonyms of important things you have to keep in your mind. So denticles is pulp stones. One way of classifying denticle is free and false denticles. There is another way of classifying this pulp stone. What is it? Free, attached and embedded. So it is given already in the picture. Free means it is lying free in the pulp. Attached means it is partially attached to the dentin. Embedded means it is completely seen within the dentin. All these are types of denticles, but I said there is another type of calcification that you see. It's called diffuse calcification. Now, diffuse calcification is mainly seen in the root, whereas pulp stones can be seen either in the pulp chamber, that is in the crown, or in the root canal, any of that, but most often in the pulp chamber, that is denticles. Diffuse calcification mainly seen in the root canals. And as you can see, it is diffusely arranged. It is usually bordering the blood vessels. Close to the blood vessels only you will see this diffuse calcification. And what is very, very important for both diffuse calcification and pulp stone is that they are all calcified structures, right? So what is the clinical problem that you will get whenever a person has to undergo root canal treatment? So this will have an hindrance in doing the BMP. When the endodontist or root canal specialist is trying to do a biomechanical preparation and BMP, this root canal and pulp chamber, the presence of calcification will be providing a hindrance and difficulty that you have to keep in your mind. That is the clinical application of this. And second thing is, what type, why do you see this calcification? What is the etiology for that? It is a soft tissue. Generally, soft tissue are not supposed to undergo calcification. But why only in certain condition as the age goes or in certain situations you are having calcification? That is because they are representing dystrophic calcification. So what is the meaning of dystrophic calcification? Dystrophic calcification means if you see a dead or degenerated tissue, if you see a dead or degenerated tissue, that area may undergo a pathological type of calcification, which means it's not normal, it is pathology. It may undergo pathological type of calcification that is called dystrophic calcification. Therefore, pulp stones or denticles and diffuse calcification, they are all examples for dystrophic calcification. Just for your understanding, I am telling you, there is another type of pathological calcification that's called metastatic calcification. So what is the difference between dystrophic and metastatic calcification? Dystrophic calcification will occur in dead or degenerated tissue, whereas metastatic calcification will occur in normal tissue. Why in normal tissue you should get calcification? Because of increased blood calcium. So if in the blood, the normal serum calcium level is 9 to 11 milligrams. But sometimes when the blood calcium is increased, hypercalcemia occurs. That excessive calcium will go and get deposited in the normal tissue. That is what is called metastatic calcification. So pathological calcification can be of two types, dystrophic and metastatic. In dystrophic calcification, it occurs in dead or degenerated tissue. Example is pulp stone and diffuse calcification. Whereas metastatic calcification occurs in normal tissue due to hypercalcemia. That has got no connection with pulp stone. Only for comparison sake, I am just telling you. So clinically, when you are doing any treatment involving the pulp, or what are the considerations that you should have in your mind is that in case of root canal treatment, I already mentioned, if there is pulp stones, then you have to keep that in your mind whenever you are negotiating the canals. That is very, very important. And whenever there is any disease process like caries or any microbial invasion of the pulp, sometimes the pulp may undergo necrosis. So what is the effect of inflammation? At the end of inflammation, the tissue will undergo necrosis. That is the end point of inflammation. So whenever there is pulpitis, as a result of pulpitis, the pulp may undergo necrosis, and that is called non-vital tooth. So in that cases, the vitality of the pulp has to be checked, and then only we have to proceed with the treatment. And sometimes because of apical foramen, there is connection between pulp and periodontal ligament. Therefore, any disease of the pulp may enter into the periapical region. Same way, any disease of the periodontium may enter into the pulp. That is called as pulpoperiodontal lesion, where you have combination of both pulpal as well as periodontal lesions. So all this you have to keep in your mind clinically when you are seeing the patient. It is very helpful for diagnosis as well as for treating the patient. So to summarize, dental pulp is similar to periodontal ligament in so many aspects that both are specialized connective tissues which are derived from ectomesenchymal derivative, and pulp is very unique because it is enclosed within the tooth, and in the crown portion you call them pulp chamber and in the root portion you call it root canal, and it is made up of cells, extracellular substance and all the other connective tissue elements like blood vessels, nerve fibers and lymphatic vessels. Histologically, you have 4 different zones of the pulp, which is the odontoblastic layer starting from the dentin. Then you have the cell-free zone, cell-rich zone and the pulp core. Thank you.